Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by assessing the pattern and condition of your thinning edges so you know what to treat and why. Check for breakage versus true hair loss. Gentle tug testing helps. Once done, cleanse with a mild shampoo and condition to restore elasticity. Don't use harsh sulfates that strip moisture. Make sure to stop tight styles and heat. Reducing tension immediately lowers ongoing damage. Gather a satin scarf and a wide-tooth comb so you can move into targeted care without causing more stress. You now move into targeted treatments that promote regrowth and prevent further breakage. Apply topical agents like 5% minoxidil if appropriate and approved for you. It works by prolonging the growth phase. Meanwhile, perform a daily 2 5-minute scalp massage with light oil to increase blood flow and reduce scar tissue adhesion. Once a week, use a protein moisture balanced mask to strengthen strands and trim blunt broken ends to stop splitting progression. Make sure to monitor for irritation and adjust routines accordingly. You finish by switching to protective measures and tracking results so progress is measurable. Wrap edges nightly with a satin scarf and choose loose protective styles that eliminate friction. Take standardized photos monthly to compare and pat yourself on the back for consistency. Remember, hair cycles mean visible regrowth often takes 3 to 6 months. If you see no improvement or experience redness, intense shedding, or pain, consult a dermatologist for blood tests, patch testing, or alternative therapies like PRP or low-level laser therapy.
Thanks for watching. Consider subscribing if we helped you.